Work self-isolation, test to work, for COVID-19. Policy and procedures. Manual COVID-19 Policy Number COV5V6.11. Applies to all fully vaccinated staff and contracted staff working in York Region's long-term care homes. Does not apply to those who have an active medical exemption. Effective date January 7, 2022 replaces January 1, 2022. Updates, amendments to testing requirements for staff returning under test to work who are awaiting their PCR test results. Purpose: this policy provides guidance for determining when staff who have been exposed to COVID-19 may continue working while self-isolating and the testing requirements to be followed. This policy will be applied in exceptional circumstances if clinical care in the homes incur a critical staffing shortage. Definitions: critical to operations. Staffing positions that are determined by York Region Senior Services Management Team is essential for providing required clinical care, resident services, and over the safe operation of the home. High-risk exposure. There is generally no one specific factor that makes an exposure high risk versus low risk. The overall exposure scenario needs to be considered to identify the factors present, and to assess how each factor and the combination of factors are likely to increase and decrease the risk in each unique situation. The Employee Health Unit (EHU) will determine whether an exposure is high risk or low risk. Examples of a high-risk exposure may include: staff living in the same household as a COVID-19 positive person, while the positive COVID-19 case was infectious and not self-isolating. Staff who have been advised by public health to self-isolate based on a positive case in their child's class and that their child is considered high risk. Staff who have had close and prolonged contact with a COVID. Work self-isolation policy and procedures, January 2022, page 1 of 7. Community and Health Services Department Paramedic and Senior Services Branch Long-Term Care. 19 Positive case without appropriate PPE. Other scenarios as determined by the EHU. Ongoing exposure. Situation where a staff member is in regular contact with a confirmed case, for example, staff lives in the same household as a confirmed case. Work self-isolation, test to work. Strategy to preserve and protect the long-term care workforce. This strategy permits staff who have been exposed to COVID-19 to continue working by taking additional precautions, including additional testing, isolating during meal breaks, etc., while working for a period as determined by the Employee Health Unit. Isolation is still required outside of work. Policy. The key requirements of this policy are as follows. 1. Authority to implement work self-isolation measures. Outbreak. If the home or a home area is in outbreak, York Region Public Health Unit is responsible for permitting work self-isolation for staff. No outbreak. If neither the home nor any home areas are in outbreak, the Director of Senior Services may permit work self-isolation for staff in consultation with the Employee Health Unit and York Region Public Health. 2. High risk and ongoing exposures. Fully vaccinated staff with a high risk or ongoing exposure to COVID-19 may return to work under work self-isolation protocols if you meet the following 4 criteria. A. You remain asymptomatic, and B. You have received a PCR test and while waiting for your results, you have had 2 negative rapid antigen tests taken 24 hours apart, and C. You are actively screened ahead of each shift, and D. You continue to test negative on the additional testing requirements set out in the procedures section. Work self-isolation will be decided upon a case-by-case basis in consultation with EHU. 3. Low-risk exposures, as determined by EHU. Asymptomatic staff with a low-risk exposure to COVID-19 may continue to work while awaiting their test results and are not required to follow work self-isolation. 4. Staff on work self-isolation must identify this measure during screening and follow established public health measures while at work and at home. Work self-isolation policy. Staff who develop symptoms while on work self-isolation must obtain a PCR test as soon as possible and isolate at home. Symptomatic staff who are waiting for their test results or who have tested positive for COVID-19 may not work in the homes until cleared by EHU in conjunction with York Region Occupational Health Physician. 6. Working in more than one facility when a home is in outbreak. Staff, including those on work self-isolation, who work in a home in outbreak may work in another facility subject to the following criteria. The decision is made in a case-by-case basis in consultation with York Region Public Health. The staff member who works in the outbreak unit in one home also work in an outbreak area at the second work location. The staff has received all recommended doses of the vaccine, third dose for those eligible, otherwise 2 doses. Staff member have not had a known high-risk contact of a case. The home/health care facility and staff member maintain excellent IPAC practices including appropriate PPE. The staff member must be actively screened daily and rapid antigen tested daily. 7. In rare circumstances, in a critical staffing shortage when the health and safety of the home's residents are concerned, fully vaccinated staff who are cases, symptomatic or tested positive, may return to work if approved by AHU and York Region Public Health under work self-isolation protocols and under the following 3 criteria. A. Healthcare workers HCW must wear fit tested, seal-checked N95 respirators at all time during work. Staff working alongside HCW must also wear fit tested N95 respirators at all times. B. Non-HCW must wear a well-fitted medical mask or KN95 mask, if available. Staff working together must maintain physical distancing at all times and preferably wear a well-fitted medical mask or KN95 mask. And C. Work self-isolation would ideally only begin on day 7 after 2 negative rapid antigen tests at least 24 hours apart, i.e., day 6 and 7. Note: an individual with a confirmed COVID-19 infection should not be retested for 30 days and will remain on work self-isolation for this period. Work Self-Isolation Policy and Procedures, January 2022, page 3 of 7. Community and Health Services Department Paramedic and Senior Services Branch Long-Term Care. Procedures. This section contains A. Procedures for determining if staff can be in work self-isolation. B. Testing requirements for work self-isolation. C. Requirements for staff who are in work self-isolation. A. Procedures for determining if staff can be in work self-isolation. 1. The LTC management team will consult with the employee health unit and refer to current provincial guidance documents to decide if staff who are critical to operations may be placed in work self-isolation. 2. If the LTC management team determines that the staff person may be in work self-isolation, they will A. Notify public health. B. Notify staff person when work self-isolation protocols may start and end. Note: AHU will notify the staff person in writing of the decision to begin work self-isolation. C. Follow the Ministry of Health's key principles for reducing risk. The fewest number of high-risk exposed healthcare workers should be returned to work to allow for business continuity and safe operations in clinical and non-clinical areas. Those who have received 3 doses should be prioritized to return before those who have received only 2 doses. Staff should avoid working with immunocompromised individuals. Only bring back asymptomatic individuals, and exposed individuals should have daily negative RAT. Early return of a high-risk contact with negative test is preferred to early return of a known case. Those greater than 5 days from last exposure to a case are preferred to those less than or equal to 5 days from exposure. Those with a high-risk contact in the community are preferred to those with a household contact. Returning to work in an outbreak area is preferred to working in a non-outbreak area. B. Testing requirements for work self-isolation. Work self-isolation policy and procedure. The testing requirements for staff on work self-isolation depend upon the nature of the exposure to COVID-19, as shown in the chart below. Prior to returning to work, staff must have a PCR test and, while awaiting their PCR results, they must have 2 negative rapid antigen tests (RAT) taken 24 hours apart. Staff must continue to test negative on their additional testing requirements shown in the chart below to continue working. Note: in healthcare settings, the frequency of rapid antigen testing may be determined by York Region's Occupational Health and Safety Team. Nature of exposure. Work self-isolation. Additional testing requirements. While work self-isolating, no ongoing exposure to case. 10 days since last exposure. Daily RAT until 7 days past the last date of exposure. Ongoing household exposure. Work self-isolation for 10 days from last exposure to the case in their period of contagiousness, up to 15 days from the date on which the household case became symptomatic or from the date of the positive test of the household case. Daily RAT until 15 days past the last date of exposure. Ongoing outbreak exposure. Work self-isolation until 10 days after exposure to the last case, presuming ongoing exposure during the outbreak. Follow PHU guidelines for RAT and PCR/rapid molecular testing as part of recommended outbreak management testing. See requirements of staff who are in work self-isolation. 1. Staff in work self-isolation must continue with the following protocols until the employee health unit confirms they are no longer required. Wear surgical/procedure mask or fit-tested N95 respirator or approved equivalent, face shields with side protection or goggles, and any additional PPE based on routine practices and additional precautions. Perform meticulous hand hygiene, and follow all other required IPAC and screening protocols. Maintain physical distancing, remain greater than 2 meters/6 feet from others, except when providing direct care. Work Self-Isolation Policy and Procedures, January 2022, page 5 of 7. Community and Health Services Department. Self-monitor for symptoms of COVID-19 daily, even when not working, including taking your temperature twice per day to check for fever. Travel to and from work in your private vehicle. If you must take transit, wear a surgical/procedure mask and perform hand hygiene before and after your travel to work. Not eat your meals in a shared space, for example, conference room, lunchroom, with other staff. 2. Staff must follow self-isolation recommendations outside of the workplace as per how to self-isolate fact sheet. 3. If you develop COVID-19 symptoms while on work self-isolation, notify your immediate manager/supervisor and employee health unit. Have a PCR test and RAT. If you are at work, go home and self-isolate. Roles and responsibilities. Role responsibilities: Employee Health Unit. Advise LTC staff on isolation requirements and work self-isolation protocols. Long-term care staff. Advise their supervisor and AHU of any exposure to or symptoms of COVID-19. Follow the requirements of this policy and direction of supervisor, Employee Health Unit, and/or York Region Public Health Long-Term Care Management Team. Communicate requirements of this policy to all staff. Determine staff positions that are critical to operations. Advise staff if they must self-isolate at home or if they are eligible for work self-isolation. Advise public health if work self-isolation is being considered for a staff member. Authority Directive Number 3 for long-term care homes and under the Long-Term Care Homes Act, 2007 as current. COVID-19 Interim Guidance, Omicron Surge Management of Critical Staffing Shortages in Highest Risk Settings, as current. COVID-19 Case, Contact and Outbreak Management Interim Guidance, Omicron Surge as current. COVID-19 Guidance Document for Long-Term Care Homes in Ontario as current. Updated Eligibility for PCR Testing and Case and Contact Management Guidance in Ontario, December 30th. Work Self-Isolation Policy and Procedures. Public Health Ontario's How to Self-Isolate Document, October 2020. Public Health Ontario's How to Self-Isolate While Working, September 17, 2021. Public Health Ontario's How to Self-Monitor, July 31, 2020. Test to Work Memo from Chief Medical Office of Health, December 17 for hospitals and EMS. Ministry of Health COVID-19 Fully Vaccinated Status in Ontario, as current. Approvals Manager, Policy and Planning, Employee Health Unit, Legal Services, Administrators, Director, Senior Services Policy. Contact Senior Program Analysts. Review period annually. Work Self-Isolation Policy and Procedures, January 2022, page 7 of 7. 7. 7. 7. 7.